Hi, I'm at Round Lake with my friend Brad. He's typed up here. Yeah. And actually we've already done the swim. It's pretty chilly. Actually it's really chilly. And it's blowing and chilly when we got out. It's called Round Lake. And you can see it's fairly round, so no cutting the corners here. What I was thinking about on the way up was Uganda Nursing School Bwindi and its origins and what it's come to, its fruition. And one of the reasons is I got an email from Jane Anoyo where she had just graduated from Villanova with a PhD in nursing education. Congratulations, Jane. And now she's back at the Bwindi. But the way the whole thing transpired was many years ago. I was at a lodge called Guerrilla Forest Camp, and I met Jim Javinson and Steve Wolf. And I overheard a conversation where they were talking about, they were in fly fishing in Mongolia, and I like flying fishing. And I thought, whoa, Mongolia. And they had a Russian helicopter where they would spot fish out of the helicopter, then drop down and go catch the fish. Well, a great story. So I wanted to engage in the conversation. We started talking, and they said, what am I doing here? And the doc, well, I got a hospital. Well, kind of. We're still working at it. And they said, why don't you come over for dinner? And actually, they said, bring a friend we had met, because they had kind of made a little tour. And they said, bring Jane. And so I brought Jane to dinner, and we had a really nice meal, great conversation. In the course of the conversation, Jim and Steve asked, what are your needs? I listed a few that were kind of top of my mind. Land acquisition, they were interested in that. We needed help expanding our x-ray, or not in that. Doubling the size of our surgery unit, nope. Then didn't really pick their interest. But then Jane said, what about a nursing school? And we thought, wow, that's interesting. And they're really interested. And Jane went on to expound that this is a rural location. We can train nurses to go out in the villages and bring healthcare to remote settings. It's a very unique area here, and we could bring health out to the community. And the way we could do it is by educating nurses. And they were very interested, and they asked me how much it cost, and I had no idea, because I really hadn't run the numbers and never even thought about having a nursing school. And so out of the blue, I calculated a few rooms and a few buildings here and there, and $150,000. And surprisingly, they said we're in. Well, when I went back to the management committee, they were delighted with the nursing school, but they looked at what it would cost, and they came up with another number, $450,000. And I got in touch with Jim and Steve, and they were still in. And then finally, we ran really good numbers and got the costing of the building, and it turns out it was around $650,000. But they said they were still in. Wow. So out of area that had lain fallow, 15 acres that had lain fallow for quite a period of time, was born the Uganda Nursing School Bwindi, and Jane was in a leadership position of that institution. But lo and behold, she went off to Villanova to get a PhD. And then after you have a nursing school, how do you equip it? Well, Jerry Hall in Reno came along, and he equipped a simulation lab where the students could practice on mannequins before they go into the hospital and get involved with clinical medicine. And a computer lab and library and teaching classrooms and all that came from Rotary. And then we developed collaborative relationships with several universities. University of San Francisco through Alexa Curtis. Developed a collaborative relationship with that University of Nevada, Reno, Deb Schindel, and University of Scranton Nursing School, Charlie Pinches. All these collaborations have produced a teaching institution that produces nurses that can go out and provide healing in remote settings. It's a real gift. My friend Brad and I were talking earlier on the hike, and we get into more reflective things, and Brad likes to, a student of Jung, and we talked about Carl Jung, above his office, and written in Latin, is called or not called, God is present. When we think about this project of the nursing school, Was God present every step of the way? The meeting with Jim and Steve and Jane, Jerry coming along, and Alexa and Deb and Charlie, and all these things we think of serendipity? Or has God been present all along? Thank you, God, for producing a wonderful project that has brought people together and delivered healing to a remote area of the world. God bless.